For your health, I'm Kat Carney. If every new year brings a new wrinkle on your once smooth brow, you're not alone. You know, this area right here. For the past few years, wrinkle-phobic Americans have turned to a face-freezing serum known as Botox to control the formation of new lines. But now there's a new option. It's called Myobloc. And take a look at these dramatic photos of this woman who once had wrinkles and now they're gone. Now, to tell us more about Myobloc, I'm joined right now by board-certified dermatologist Dr. David Goldberg. Thank you so much for joining me this morning.
It's a pleasure to be here.
Now, tell me about Myobloc. How new is this?
Myobloc is quite new. It's now offered as the alternative to Botox, although it works somewhat differently.
Now, I kind of overstated here that I said it's a face-freezing serum. How exactly does it work?
It works by interfering with our ability to contract those muscles that create those deep frowns.
Mm-hmm. And how expensive a procedure is it?
Depending on the amount being used, it can cost anywhere from $200 to $1,000 in terms of the wrinkles being treated.
Now, I was really surprised at how simple a procedure it was. One of our staffers had it done earlier today, and it took very little time. We're going to show some video here of the procedure on one of our staffers, Kate. There we go. Now tell us a little bit of what we're seeing here.
Well, we're preparing the area to be treated now. This is less than a 5-minute procedure. In terms of treating those deep furrows that you see between her eyebrows, we treat 5 injection areas there. It does pinch a little bit, and there's no wound left. She can go right back to work, and nobody will know the difference.
Now, is there anyone who should not have this done?
We don't do this in pregnant women. Otherwise, it's acceptable in everybody.
Wow. Oh, and here is Kate. Hi, Kate. Now, I got to ask you this. Did it hurt?
Yes, but I have to say that the size of the needle was so small that it really helped my apprehension about doing this.
Now, Dr. Goldberg, show us how this is going to affect her.
Well, if she creates the furrows for us, and now she looks a little angry with me for what we've done, you can see these deep lines here. Mm-hmm. Within about 24 hours, she'll still have some lines, but they won't look anywhere near as deep.
Well, we're going to have to check in with you on Monday and see if you can still make that expression. And thank you, Dr. Goldberg, for being with us today. You're going to stay with us and talk to us about some more anti-aging treatments, and we're going to look forward to that. But in the meantime, if you want more information on Botox or the new Myobloc, both products have websites, Botox.com and Myobloc.com. For your health, I'm Kat Carney.